Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.
Hi, and welcome to Berks Community Health Center Presents. My name is Debbie Hartranft, and I'm the Chief Community Relations Officer at BCHC. So childhood obesity is an increasingly serious problem in the United States. It's estimated that 1 in 5 children have obesity. Children with obesity are more likely to develop other serious issues such as heart disease, type 2 diabetes, and they also are more likely to suffer from anxiety, depression, and low self-esteem. This is a challenge for parents because addressing their child's weight often means making lifestyle changes for the whole family. So today's topic is achieving a healthy weight for kids. And with me today to discuss this important topic is Dori Goulden, BCHC registered dietitian, and Jeannie Stephen, CRNP at Berks Community Health Center's Oak Brook location. Welcome, Dori and Jeannie.
Yeah, thank you. Thanks for having us.
Oh, thank you. I really look forward to having you both as a guest pretty much every month.
We're getting to be regulars.
You are doing an amazing job. So the statistics are pretty alarming. And so let's start first with how they categorize a child's weight. And I think we have a slide here.
Yeah, so we have our growth chart scale here. So what we do when you bring your child in for their well child visit, we kind of document their height and weight on this nice growth chart, and it helps us to kind of trend and track how your child is growing and progressing compared to actually other children. So if a child falls, it's documented in percentiles, and if the child falls between a 5 to 84%, then that's considered a normal weight. When they get to be like the 85 to 94%, that is considered to be overweight, and then obesity would be if they're ranging into the 95th percentile. So it's really important to then, we like to emphasize getting that well child visit. So if it's kind of a red flag to the provider that, if we see your child trending up, we want to intervene and, sit with a parent and develop, a plan of care to help get your child back on track.
Quick observation, I think. So if children have become slightly heavier over the years, I mean in general and on average, that percentile, that's going to shift as well, right? Because it's based on other children. Is that right?
Exactly, yes.
Yeah, okay.
That's right, yes.
Okay.
Yeah.
So a child's identified as obese. So what kind of effects is that going to have on the body?
So if we move on to our next slide, it's very interesting that, it kind of does affect the whole body, lots of body systems. You wouldn't think that how can it affect the skin, but there's this condition, it's called acanthosis nigrans, and that's kind of a mouthful, but it's a red flag to the healthcare provider if they see this condition. And what it looks like, it's kind of a darker pigmentation on the skin. It can develop typically on the neck, and it looks like velvety in appearance. So we kind of look at that and we think, a little alarm goes off in our head that this child might be prone to getting diabetes, to becoming insulin resistant. And I would say if any parent were to see this on your child, then you want to bring that to the attention of your healthcare provider. Other issues would be being overweight and obese with children. It can make asthma worse. It can also cause sleep apnea. And what sleep apnea is, it's basically kind of this physical condition that affects the lungs where you get like excess weight in the abdomen, and then the child lays down and it kind of presses on the diaphragm. The actual weight from the abdomen presses on the diaphragm. So a parent might notice that the child looks like maybe they're holding their breath at night for a few seconds, a few seconds of just where they look like they might stop breathing. If you notice this in your child, you definitely want to have that discussion with your provider. Other effects would be cardiac. So with being overweight, the extra weight, what happens is we have fat streaks that are going to develop in the arteries. And also it's going to kind of stiffen the arteries. This is progressive. It's going to happen over time. It's not going to be an immediate. It might follow you into adulthood and unfortunately cause you to have some chronic illnesses in adulthood. We have this nice little artery here, if people can see this, and this is actually plaque, and it looks exactly like just some fatty streaks building up into a healthy artery. And then back to our slide, we have in the stomach, so your liver can actually get fat deposits. And so what that causes is kind of this inflammatory process in the liver, and it can also happen in the gallbladder, where you get an inflammatory process. You can have gallstones develop. In the liver, over time, if it persists, you can have cirrhosis, which is basically inflammation in the liver. Probably the most detrimental effect for the child is the psychological effect of having, being overweight or obese. All the kids have access to the internet. They have cell phones. You have Instagram, you have Facebook, TikTok, and YouTube. The cyberbullying can really become a problem. The kids can develop anxiety, depression. They can miss school days. They can have their grades affected, failing school or poor grades. Certainly, if you would notice this in your child, you would want to discuss this with your healthcare provider.
Wow. So let's talk about long-term outcomes of obesity.
Yeah, again, unfortunately, a child that, if you're overweight as a child and overweight and obesity, unfortunately the statistics show that it can progress into adulthood. We kind of have this umbrella term, and it's called metabolic syndrome, where you can develop diabetes, hypertension, high cholesterol. So this is kind of what we call a metabolic syndrome that you can develop. And, it's going to, end up on lots of different medications and lots of trips to your provider. Mm. Sleep apnea, again, is another issue where, again, just the extra weight in the abdomen, you can develop difficulty breathing, and that can also lead to some cardiovascular problems. Future fertility. So for the young girls, basically, it's kind of like a hormone imbalance, and the girls can actually stop menstruating. They can have irregular menstrual cycles. For the young men, they can have lower sperm counts, and so that's going to affect them into adulthood when they're looking to start a family.
I have never heard of that potential long-term effect.
Right. Yeah, it's really interesting how just lots of different things that you don't think about. Other things, of course, again, autoimmune diseases. So it's really hormone imbalance caused by being overweight. It could lead to like rheumatoid arthritis, lupus, fibromyalgia are just a few of the autoimmune diseases. Then we look at osteoarthritis. So it's just the extra weight on the back, the extra weight on the joints is going to cause you to have joint pain, back pain. That's you're really just going to affect your overall mobility. Lastly would be, when you look at this, you would say, well, how can being overweight cause just increase the likelihood of cancer? So we could go back to our liver with the fat deposits on the liver. And so again, inflammatory process, you can develop into a cirrhosis. And so really when you think about it, it's kind of like your normal healthy cells are becoming abnormal. And then in turn, because of all this inflammatory response, these abnormal cells can turn into cancer cells. Not always, but it's just that potential. It's just kind of that added risk.
Right. Wow, that is quite a list of potential outcomes.
Yes, yes.
So what screenings are available to determine, how serious the problem is for a child?
Yeah, so again, it's super important. Just get your child in for those well child visits. And depending on the age, we're going to check your child's blood pressure. We're going to check cholesterol, especially if you have family history. So if you have family history of diabetes or cholesterol concerns, then we're definitely going to just kind of get some basic blood work on your child. Check a fasting blood sugar, so that's going to tell us if your child is going to be at risk for becoming either insulin resistant or potential for diabetes in the future. So we would say a normal blood sugar should be about 99, between about 60 and 99. Fasting insulin is another important indicator. So this would be kind of a precursor diagnostic lab that would tell if your child is going to potentially be resistant to insulin. And when we talk about insulin, it's a hormone, and what it does is it kind of just helps the body to metabolize sugar. It helps the body to process sugar. And really, when you think about it, if your body is kind of flooded with sugar, the pancreas can't produce enough insulin to help appropriately get rid of all of the sugar. And lastly, an A1C. So an A1C is a really nice blood test to do. We can do it in the office. It can be a simple finger stick. And what this tells us is what is your average blood sugar over a 3-month period. So that, again, is a really nice test to get done, and it can be done right in your doctor's office. So with all of this, I would say just so important, get your well child visits in, and typically, for the most part, we have nice, healthy young children. They're nice and healthy. You only need yearly physicals. We get you up to date on all your vaccinations. And at Berks Community Health Center, we have plenty of new patient appointments. So come on in and get that well child visit done.
Wonderful. Great advice. So once we know there's obesity, and really any child should try to live a healthy lifestyle, and what lifestyle habits contribute to obesity, and should they be aware of?
Yeah, so I think one of the biggest contributors is just, our daily lifestyle and how kids are just less active than ever. I know my neighborhood, I try to get my kid to go outside and play, but sometimes there aren't other kids outside playing, so he doesn't want to go out. So kids are a little more glued to their screens. When I was a child, we didn't have iPhones, and the internet wasn't even as readily available. So now kids can just kind of tune into their phones and their tablets. So not only are they not being as active, going out and playing, but they're also just sitting, more than ever. Also, portion sizes are a contributing factor, and access to more junk foods and processed foods. We just don't have as much time in our schedules, to sit down and have healthy meals with our family. So we're really just, resorting to a lot of things like frozen pizzas and fast food. And those types of foods just tend to lead to an overweight status more often.
Yeah. And so sugar sweetened beverages, soda.
Yeah.
Oh my goodness.
And
juice.
Yeah, soda is, I don't like to demonize any food. I really like to say that, foods and drinks we enjoy can really fit into our lifestyle, but soda is just one that I really try to get everybody off of because there's just really nothing positive about it. It has chemicals, preservatives, caffeine, which kids really don't need, and then a really high sugar content, about, 10 to 12 teaspoons of sugar per serving. And if you're not getting a lot of activity, you're not really getting rid of that sugar. So that sugar then gets deposited as fat. And as Jeannie was saying, that can really lead to fatty liver or fat depositions on the liver in adults, but we also see it in kids.
What's interesting about soda is I'll drink diet soda and then I'll stop it for a period of time. And then when you drink it again, you're like, it's not that good taste. Like it's almost an acquired taste that you get used to, but when you back away from it, it's not great,
Yeah, that's true.
That's what I have to kind of keep in the back of my mind. So let's talk about juice.
Yeah.
Yeah, it's pretty prevalent. It seems like it's the go-to drink for children most of the time.
And I think there's also a misconception with parents that their children need juice. I hear a lot, well, it has vitamin C, and my kid, doesn't get a lot of fruits and vegetables. So I just try, to have parents, start trying to switch over to whole fruit instead, just because, juice can really, also contribute to weight because it does have a high sugar content, even if it's natural sugar, but it does have calories as well. And really, the beverage we should all be drinking more than anything else is water. And I find that kids can kind of, just like you said, almost get addicted to juice or just think, oh, well, I don't really like water now because I'm just so used to getting that sweet flavor or that energy, rush from the juice.
Right.
But I put there on the slide, at every age in a child's life, there is a recommendation from the American Academy of Pediatrics for about how much juice you should have daily. And it's really not a lot at all. I usually tell most parents, maybe juice once a day, about 4 to 8 ounces, depending on your child's age. Really try to opt for whole fruit instead.
You say focus on more water. Low-fat milk. So I have grandchildren, and early in their years, the parents are encouraging whole milk because they need so much fat in their diet. But you're saying low-fat milk here. Is there a point in time where you switch over to the low-fat?
Age 2.
Age 2, wow.
Yes. So you would really try to transition to, 2%, maybe then 1%. Skim is, people don't tend to like that sometimes, so I feel like a good happy medium is 1% milk.
Okay. And the artificially sweetened diet sodas.
Yeah, I really try to get kids off of those as well, just because there are some studies showing that artificial sweeteners can actually make you hungrier later in the day and crave sweets. And again, even the artificially sweetened sodas still have caffeine and still have chemicals, which kids really don't need. And we really just want to get them accustomed to going for water when they're feeling thirsty.
Right. Okay, so you have some alternate drink ideas here.
Yes.
For our viewers.
Yeah, there's even a picture of something that has Capri Sun on there.
Yeah.
So that's actually a product that I kind of like. It's sweetened with something called monk fruit, which is an all-natural sweetener. It still has 1 gram of sugar, just for kids who are very resistant to water, because I really encounter that a lot. And then the parent will tell me, well, if I don't give them juice, they won't drink anything, and then they'll get dehydrated. And I usually tell parents, if your child becomes that close to dehydration, they're going to reach for water. So it's really what you have accessible in your home. If you want to give your child something different, I have a couple ideas there on the slide, and I brought something with me. So sparkling water that has 0 calories and zero sugar, no artificial sweeteners. So sparkling water can be a nice alternative. It can be something, when a child wants something other than water. Another product I have here is something that you could add to your water. It's like a packet of, it's not like Crystal Light or something that has artificial sweeteners, but this doesn't have any artificial sweeteners. It's made with stevia. So it gives you a little bit of sweetness, but not like an overwhelming amount of sweetness. It's just something for when kids, want something different, but you're not going to go for soda.
Is stevia safe?
Yes.
Okay.
So far. So far.
Yeah, everything eventually.
I know.
Yeah, and I don't think we had the camera on you when you were showing the
the other,
water.
so sparkling waters.
It's a Waterloo.
Yeah, they're different brands. Sometimes I encourage parents, to actually look at the ingredients and see if there's Splenda or other things added. I do try to get parents away from those things, but just plain old sparkling water that has zero sugar and 0 calories is an okay option.
Okay, wonderful. Adding fruit slices to water.
Yeah, sometimes I will take a, like a jug of water or, like a clear container, and I'll just add water, and then I'll add different things like different fruits, like watermelon chunks can be really tasty. Cucumber can be pretty refreshing. You can add any fruit, and I use that, when something's kind of starting to go, kind of bad. I'm thinking, okay, what can I do with this fruit? And you can really just chop it up and put it in water and let it sit in your refrigerator for about a day, and that will kind of seep into the water and give it a little bit of natural flavor.
Wow. Okay. And fruit juice ice cubes in water. That's an interesting one.
Yeah, if you have a child who's very resistant and wants that juice, that can be a strategy, to include a little juice, but put it in their water so it's very diluted, and then they're still mostly getting water.
Wow, good ideas. Thank you. And then you have hint water as the last one.
Yeah, that's actually probably my favorite. We use that in my house. They have it at Walmart. They have it all over the place. It's a really nice water that has just a hint of a fruit flavor, but no sweetener.
Okay. So, is there a formula to maintain a healthy weight for a child? Is there something parents can follow as a guideline to help them on this journey?
Yeah, so I, kind of will work with families in my office, and we call it the 5-3-2-1-0 plan. And it's basically just kind of like a formula, like you said, for how to kind of plan your day of eating. So personally, I have a 12-year-old, and I try to get, at least 5 fresh fruits and vegetables per day, as much as I can, or I at least offer them. They may not always accept, but at least if they're getting, repeated exposure, it can help with better acceptance over time. So, aim for at least 5 fresh fruits and vegetables every day. I usually try to add 1 to each plate or snack. And then structured meals, I think that's lacking a lot.
Yes.
Kids are busy at night. Sometimes there's lessons or there's sports or there's appointments, and you might not, have the opportunity to sit down as a family, but really trying to have like a structured meal can really help cut down on snacking. So I really try to have children work on getting a breakfast, a lunch, and a dinner meal.
Okay. Screen time.
Yeah, it's a toughie. So again,
2 hours sounds even like a lot, but when you think of it,
oh,
I'm
it's
sure
nothing.
Exactly.
Yeah.
Exactly.
And again, like my kid, I think is pretty active. He does eat pretty well, but he will sit and watch TikTok. It's hours. It's really hours. So I try to cut that down, so even a dietitian's kid is getting more than 2 hours a day. So really trying to kind of cut it down as much as you can and just talk with them about, well, this is why we want to cut down on that, and we want you to have opportunities to go do other things and to just, be a little more active.
Yeah. 1 hour of activity, that makes sense.
That's the goal, yep. And it doesn't have to be exercise. It can just be playing. It can be going outside, taking a walk, walking a dog. So you can really get those minutes in lots of different ways.
Okay, and then 0, avoid sugar sweetened beverages, which
Yep.
we just talked about. We only have a few minutes. I want to definitely get to all your content
Okay.
here because you really have some important guidelines here. So let's talk about the plate. healthy portion plate.
Yeah, so here I'm mostly really talking about dinner at night. But if you can kind of make your lunch half of your plate vegetables, that would be great. But it's really just important to have exposure. So always putting a fresh fruit or vegetable on all of their meal plates, just so it gets them in the habit of eating and liking those flavors. And again, having a fruit instead of a juice. A lot of kids and parents will tell me that they have orange juice with breakfast. Really just put a clementine or an orange on that plate instead.
Great. And here's some pictures of the portion plate. And I think you have some audio visual over there as well.
Yeah. So I forgot to do a slide about snacks, but I was alarmed when I read a couple years ago that sometimes a child's calorie intake can be 40% coming from snacks.
Wow.
So then you really want to focus on making your child's snacks a little healthier. So I have a plate here. I always try to put some kind of a cut up veggie, a fruit of some kind, maybe a source of protein, because that can help you feel full, and there's calcium and vitamin D in cheese. You could also do a Greek yogurt, and then maybe something a little junky, but try to watch, the portion size of the processed foods like cookies and potato chips and stuff like that.
Would you consider that one snack, or are you saying those are different options?
Well,
individually as a snack.
Yeah, I like to present something that's going to be visually appealing, and I find that if you do a fruit, a vegetable, a protein, I usually always do those three components with a snack, and then kids will ask for, okay, well, where's the chips? Where's the good stuff? So then if they're filling up on fiber and protein, you can maybe do a little handful of like a junk food. So I would give my child a snack that kind of looks like this, and he's ready to eat dinner in another hour or two.
Yeah, and I would just add to look at that. I mean, the grapes, it's so low calories, and the sliced pepper.
Yeah.
It's just so low calorie, and it fills them up. Yeah.
Good point. Yes. Okay, let's quickly talk about activity. I think we have 1 minute.
Okay.
I know.
Yeah, so with activity there, I just like to focus on if your child is overweight, be very sensitive about how increasing activity may be a little painful at first. So, even though you may go to the doctor's office and they may say, okay, well, the goal's an hour a day, but maybe try to work up to that over time, and maybe talk about doing different things like taking a walk, walking the dog. It doesn't have to be exercise or going to a gym. It can just be really movement, but a little more movement than their daily going to school and walking back and forth to the bus stop.
Wonderful. Well, you presented a lot of information here, both of you. I think it's really important information, and hopefully some people learned some tips and follow them. I know it's hard. It's a lifestyle change, and change is hard. I get that, but thank you so much for presenting that. And the good news is that childhood obesity is reversible. I mean, if you take these steps, you can reverse some of the things that go along with obesity. So thank you so much for that. And our time is up, so thank you for joining us. And I hope you join us again next month on Berks Community Health Center Presents.
Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.